This year's flu strain could be a lot stronger than in past years, and it's raising fears among healthcare professionals who say this year's flu vaccine might not be the right mix. Let's bring in Dr. Masa Tehrani, board-certified rheumatologist, for more on this. This headline out of Axios: this mutated flu strain is triggering fears of a massive outbreak. The new version of H3N2 is a strain of influenza A. However, it is different from the H3N2 version used for the flu vaccine because the strain acquired 7 different mutations over the summer after the reference strains had been chosen, experts say. So, Doc, what are we in for?
Yes. Well, last year, as you remember, we had a pretty bad flu season compared. The last time we had a season that bad was 2009. And this season, it looks like we're not going to be too far behind. And the reason is because what happens is every year in February, scientists get together and they decide what are the strains that are going to be active this year. And they make that flu vaccine for the year based on that prediction. There was a mismatch this year because during the summer, this H3N2 acquired these 7 new mutations that makes the vaccine less effective. But I want to emphasize here, the vaccine being less effective does not mean that it's not going to work. In fact, we have real-time data coming from the United Kingdom that shows that it does, in fact, decrease the risk of hospitalizations and severe disease. All the more reason for people who are over the age of 65 or those with chronic conditions like asthma, diabetes, cardiovascular disease. I really advise for them to get it now. And really, my best advice is get that flu shot early, practice lots of good hand washing hygiene, and also understand that the antivirals like Tamiflu work best within the first 48 hours of infection. So if somebody is in a high-risk category and they feel those symptoms coming on because maybe the flu vaccine wasn't as effective, then I would absolutely consult with their provider to get on something.
Yeah. I was part of that absolutely brutal flu season this past February.
Me too.
So does that mean, looking ahead to this upcoming February, because I'm already scared of this upcoming February, that things could be better or worse? Does the last February, if you were sick last February, does anything carry through? Do you have any protection? And also you talked about vulnerable populations, but what about kids?
Yes, well, kids over the age of 6 months, the recommendation is for children to get it. Pregnant women can have some vulnerabilities, and again, people with autoimmunity, on immune suppressing medications, these are all groups who will benefit more from getting, because they are at risk of developing complications. Remember, we want to minimize ICU stays, the really bad pneumonias, those kinds of complications, which we think that this vaccine, even though it may be less effective, hopefully will do that. And with regards to your question about hopefully having some carryover immunity, hopefully, but really it's the immune system, and it's really individualized. You can only hope, but wash those hands and get your flu shot and take vitamin C.
Big dreams.
There you go. Good advice from the doctor. Hey, a couple of things that we want to go over quickly in the last minute that we've got here. New evidence that vitamin D and orange juice are good for your heart. Orange juice even good for your genes.
It's very exciting. John, if every single day I have patients asking me, what is the one vitamin I should take? And without hesitation, I always say vitamin D, because we have every other week there's a new data or research paper about it. This year alone, about vitamin D, we got data that it may help reduce the risk of colorectal cancer. With regards to aging, we age because our telomeres shorten. We have data now that vitamin D may decrease that shortening. So it's a longevity tool. And just last week at the American Heart Association, we got data presented that vitamin D, if you supplement patients over the range of 40, may help dramatically reduce the risk of having a second heart attack. These are amazing observations. They are observations. I know you're thinking, what dose should I take? 2,000 units for normal patients who have normal levels. But if you're under 30, then I advise a pharmacologic grade vitamin D supplementation for 3 months.
And it's just a little tiny pill.
And wash it down with the OJ.
Yeah.
Sure.
There you go.
Doc, great to see you. Thank you for the house call.
Thank you for having me.
All right.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.